We're talking about nursing, healthcare, leadership, recovery, and senior living. The show brings the best in the industry to you because it's about you. I'm Angie Graham, and we're talking about it. Welcome, everyone, to the Angie Graham podcast. I'm Angie Graham. A little over a year ago, we launched our soft episode called Haunted Senior Living in October of 2025. Since then, we have changed our name to the Angie Graham podcast, and now here we are in October again, but this year we're doing Nursing Nightmares. I just want to thank all of my listeners and new listeners for watching, listening, and downloading our show. We couldn't do it without you. So with us today is Nurse Stacy. Again, welcome back.
Hi, thank you.
As I said before, today's episode is Nursing Nightmares. We have our jack-o'-lantern here filled with a number of pieces of paper. Each number comes with a story, and we have no idea what stories we're going to watch or read. So literally, you're going to see our reaction as we hear the stories. Our producer and associate producers, I appreciate all of them for helping us out with this episode. It isn't like the rest where we try to keep it all about the conversation. Before we do that, we do have our starter story. So let's take a watch of that.
It's hard enough to lose a loved one, but the families of Heather Presty's victims say they lost their loved ones twice. Trisha Hughes, the daughter of Betty McQueenie, writing, "When I heard what happened to her, that's when I cried, and I couldn't stop crying." Keith Laskovich, the son of Marguerite Peggy Laskovich, saying, "We knew one day God would call our mother home. Unfortunately, God didn't make that call for Peggy. Heather Presty made that call." Their emotional and tearful victim impact statements spanned hours as Presty sat emotionless. The victims all died in nursing home facilities under Presty's care. 2 men and 2 women surviving Presty's attempts, but their families say they'll never be the same.
That's sad.
Wow.
So it's a Pennsylvania nurse who killed patients with overdosing them on insulin.
And it is alleged mistreated 22 patients. What a betrayal of trust.
Yeah. Personally, I'm a diabetic, and I've had a very low blood sugar in which I was hospitalized. So my blood sugar was 22. My son had to call 911. The symptoms of a low blood sugar they're awful. It feels like you're dying. Like you're sweaty, you're cold, you're anxious, your body feels like it's trembling from the inside out. So I can't imagine how they felt. It's not just like you get a large dose and you go to sleep and you don't wake up. There are horrible physical symptoms related to low blood sugar. That's just awful.
I'm sure, like everyone else, like, why?
She said, what did
Why?
she say?
It is just insanity.
Well, she said the patient would be better off dead. I guess they had, he was blind and had neuropathy from anoxic brain injury, and he was, quote, a brittle diabetic. Yeah, but as a nurse, you don't get to choose that. You don't get to choose somebody else's quality of life. Like, it's their right. If they want to live that way, or their family has chosen that for them, you still don't get to make that decision. You're not the be-all, end-all for determining that.
So many questions. I mean, 22 patients, you can't help but to think how, could you have made this determination quicker that this was happening? But she's in such a position of trust.
Yeah, absolutely. And she's giving insulin, obviously, I think, to patients who weren't diabetics. And if it looks like they died of another disease, it wouldn't trigger a suspicious death and an autopsy and a toxicology report. So it could be way more than 22, too. I mean, how long has she been a nurse? I mean, this could...
Yeah, they're saying
could be
in
decades.
the story from 2020 to 2023, but there's a lot of unanswered questions, like how long has she been a nurse?
Mm-hmm. Yeah.
And there had to have been some mental issue there. Because normal nurses don't. They're there to help people. This isn't like the normal.
Oh, no.
At all.
Well, you take an oath. I mean, do no harm.
Like a narcissist or, what mental defect would cause such a decision. It's insane. It's absolutely, and how horrifying for the families. Just unbelievable. Really is.
I mean, everybody dies, right? But you should have a choice in the way you're going to die, not a nurse inserting herself and being like, nope, their quality of life is bad or whatever her reasoning was behind it and overdosing them on insulin, which is, like I said, a very horrible way to die.
Crazy.
Mm-hmm.
And it looks like she did plea, she got a life sentence. Of course, will not bring back the lives that are lost. She got 3 consecutive life sentences. The first-degree murder, up to 760 years for criminal intent to commit murder.
Yeah.
Well, the good news is she's never going to get out.
No, ever. And she shouldn't.
And then they quote some of her texts.
Wow. Can I kill this man at Taco Bell? Okay. What happened at Taco Bell? I'm going to murder already. Wow.
I'm going to murder my aides. I drugged him already. I don't know how he is awake.
Oh, my gosh. Oh, boy. Well, not everybody should work in healthcare.
Clearly.
Oh, boy.
Okay, so we get to pick from the magic pumpkin.
The jack-o'-lantern? Okay.
The jack-o'-lantern.
A jack-o'-lantern. Number 2.
Number 2. Right after 1.
That works.
We're going in order because I like to go in order.
Number 2. So, here is the surprise. The 2 most famous nurse serial killers according to Google. So during the 1800s, 2 of the most notorious nurse killers were Amelia Dyer and Jane Tappan. Though they operated under different circumstances, Amelia Dyer from 1837 to 1896, that must have been her date of birth through death, known as the Reading Baby Farmer. Amelia Dyer was a serial killer who preyed upon desperate unmarried mothers in Victorian England. Dyer was a trained nurse who began operating baby farms, a service where she offered to care for unwanted babies in exchange for a fee. Instead of caring for them, she, however, would starve them, drug them, or strangle the infants to increase her profits.
Oh, that's so sad.
How horrible. After serving a brief prison sentence for neglect in 1879, Dyer, and her name is Dyer too,
Dyer.
changed her methods. She began disposing of her victims' bodies in the River Thames to avoid scrutiny from the doctors and authorities. Her crimes were exposed in 1896 when a sack containing the baby's body was recovered from the river, and a subsequent police investigation found evidence linking her to numerous deaths, and she confessed to her crimes. Though she was only convicted of 1 murder, she was suspected of killing hundreds of babies during her 30-year career.
That's so sad.
That is crazy. Diabolical.
Yeah, once again, not everybody should take care of other people. Wow.
And the second was Jane Tappan from 1854 to 1938, an American serial killer who operated in Massachusetts. Jane is a prime example of the angel of death killer. She had a difficult childhood and trained to be a nurse at the Cambridge Hospital in the 1880s. During her training, she began experimenting on her patients with drugs like morphine, atropine, and discovering she enjoyed the feeling of controlling their life and death.
Yeah, like she would poison her patients, sometimes reviving them multiple times before they ultimately succumbed. I can't remember the exact name, but it was probably Dateline or one of those crime shows where a nurse would give a medication to put a resident into cardiac arrest, but he was always the first one to respond and perform CPR, and everybody was like, "Oh, you're so amazing." It's like that hero complex, and he would purposely do this to patients and be the first one to be there, revive them. And then there's this other show I just started watching where they're paramedics. And they either give drugs and then they're the first ones like on the scene or to revive them or to reverse it. I think they call it like the hero complex. But that's so
And then
sad.
there's the mothers too that will do things to their children.
Oh, Munchausen
Yes.
by proxy.
Yes.
Yep, where they make their child sick. And it's like attention seeking. It's that type of behavior. There have been a lot of documented cases. I think there's probably a couple on Netflix of Munchausen by proxy. This is kind of like, Munchausen by patient, right? You're making them sick to get attention or to be the star of the show, so to speak. I don't know who could do that. I've responded to codes, and they're terrifying. They call a code blue and you're running down there and the adrenaline and you're terrifying. I couldn't imagine like purposely causing one of those, to orchestrate one of those. That's just awful. That's awful. Oh.
So the story goes on that after a series of suspicious deaths in 1901, the family of a victim ordered an autopsy which revealed that the victim had been poisoned. She then confessed to 31 murders, but is suspected of killing many more. She was found guilty by reason of insanity in 1902 and spent the rest of her life in an asylum.
Yeah, reason of insanity. That makes sense. Ooh, boy.
You got to be a crazy person
Yeah.
to do that.
Yeah, to come to work every day and that's what you're doing. That's what you're thinking
She
about.
confessed that she had a sexual thrill from holding and caressing her victims as they died. Okay, you're sick.
Yeah.
Totally sick.
Yep. I get reason of insanity.
We now know why you went to the asylum and you are no longer with us. Okay.
Oh, boy.
That's definitely a nursing nightmare. Right there.
Yeah.
Okay, the next.
So we're going to the next story, but before that, go and take the papers in front of the mics.
No?
Okay.
Okay. You don't like that noise? All right. We've got, number 7. The video.
We get a video.
Can we play the video?
Yeah, you can get it set up. She's just going to get Angie the cards for what you will be watching.
Okay. Video of hospice nurse Julie. Okay, Julie. What do you got to say here?
We're Talking About It is brought to you by Our House Senior Living. Visit us at ourhouseseniorliving.com.
People always ask me about my patients and what are the last things they say to me. And here's a good story. I'm a hospice nurse, for those of you who don't know. So I was visiting a patient. It wasn't my patient. I was helping out. And the patient was not actively dying, but like getting close, transitioning. And he was sleeping most of the visit. But right before I left, I was turned around and started walking away. I hear him go, "Hey!" Kind of scared me. And I was like, "Oh, he's awake." So I turned around. I'm like, "Hi, sir." And he goes, "You're big." Now that is not an insult in my opinion. So I just said, "Oh, thank you." And then he goes, "Yeah, you're a big lady." And then went back to sleep. For the record, I'm 5'8". I'm not that big, sir. See you later.
So you worked as a hospice nurse.
I did, yes. They're on a lot of morphine at the end. So I think the filter is completely gone. But even not on morphine, not on hospice, some people just don't have any filters. You
they tell you exactly
you
what you
just take it and say thank you and move on.
Yep. I have been visiting before, and I've been told that what I have on is ugly.
Mm-hmm.
Why would you wear that?
Yep. Mm-hmm. When I first started nursing, I got a lot of, I'm not taking meds from you. You look too, they're like, you look like you're 12. And they would refuse to take medicine from me. And I'm like, okay, I'll go get my charge nurse. When I was pregnant with my daughter, I mean, she was like a 9-pound baby. So at the end, I mean, my stomach was really far out. This resident would come, wheel herself all the way across the facility and come to my office and ask me every day, are you sure it's not twins? And I'm like, every day. And I'd say her name. I'm like, you really came all the way down here to ask me that? And she's like, you're having twins. I'm like, I am not having twins. You're too big. You must be having twins. I'm like,
So how many years did you work as a hospice nurse?
About a year. But we did a lot of hospice at the SNF, the nursing home that I worked in too.
Okay.
So and then if they weren't on hospice, you were still providing end of life care when they were at the nursing home. So.
Memorable stories
Oh, for sure.
of any. What's one of your most memorable stories as a hospice nurse or in providing end of life care?
I had this one resident. Unfortunately, he passed away alone. And he was the sweetest little thing. He always had a runny nose, but he would always come up to like his favorite nurses or aides, and he'd give us a big old kiss on the cheek, and it was just this runny like snot from his nose all over your cheek. But he was the sweetest thing. But at the end, to get him to calm down because he had terminal restlessness, one of the aides, she sang in her church choir, and she would just sit in there. Like even after her shift, we would go in there and just sit with him because he didn't have any family, and he had transitioned and was starting to actively pass away. And she would just sing to him, and he'd just lay there with a smile on his face.
So for the listeners, what does transition mean?
So you're transitioning to an actively dying phase. So your body is shutting down, and death is imminent. It just soon. I mean, I can't tell you exactly when it's going to happen, but
It's different for everyone.
Correct. Yeah. So it could last a day, a couple hours. Like I've seen it last a couple of days. Just really depends. And then if
Is the patient conscious during this time, or are they usually in a state of sleeping?
Usually it's sleeping, but they have meds on board. So comfort medications such as morphine or lorazepam for pain, discomfort.
Keeps them comfortable.
Yeah, and it's usually on a 1-hour schedule. You're giving those medications to keep them comfortable. But there are moments of like opening their eyes, recognizing people. In hospice, there's we encourage a family. There's these 7 things that you should tell somebody who's passing away. I can't remember them all off the top of my head, but it's to the effect of, everything's going to be okay, or everybody's okay. Everything's taken care of. You can see when there are residents who are holding on to something, and you don't necessarily know what it is, but just somebody saying that to them, that everything's going to be okay. You can go now. There's an actual pamphlet, a book that we would give families that instructed them through that process and that conversation, especially if you notice the residents really, really hanging on. Yeah. So, yeah, hospice was it was an honor. It was definitely a different type of nursing. I really enjoyed it. The rapport, the relationships that you create with the families, but it's taxing. I mean, I'd say every 6 months you have a whole new patient, all new patients on your caseload. So, yeah.
It's important work. It's a part of life.
Mm-hmm.
None of us get out of here
Nope.
alive. So it's definitely a part of life.
Mm-hmm.
And it's not real talked about. And so you see more and more hospice nurses or, making videos and talking about end of life.
Mm-hmm.
It is a curiosity for people. Because for many, you didn't know it's not a topic you really want to talk about, but yet you're curious about it.
Yeah. Just as, I say, just as you have birth plans, right? There's all this, how you want to deliver your baby. There needs to be death plans too, because it's going to happen to everybody. And you can have a choice of, if it's an expected death, how you want to go. Or if you're older, how do you want to go? How do you want it to look? Those are conversations to be had. and they're difficult conversations, but they're definitely conversations to be had.
And not everybody who has a qualifying diagnosis wants to be on hospice. They hear the word hospice and they're like, oh no, I'm not ready.
No, at our house, they've had residents on hospice for well over a year. It just means that the likelihood of passing away in 6 months is higher. It doesn't mean that you go on hospice and you're passing away right away. It doesn't mean that at all. So
we've also had residents go on hospice and then they get a little better and then they go off of hospice.
Yeah,
that can happen too.
They graduate is what we call it. They graduated off hospice is the term that's used. But yeah, they start gaining weight or they rebound after an illness. Like they could have had acute heart failure or acute on chronic heart failure, but the acute part resolved and now they're back up and moving around and they graduate from hospice. So definitely a possibility too. So yeah.
Oh.
Yeah, I feel her with that one. That was pretty funny, and she'll remember that forever. And there are some of them that you're just like, okay, yeah.
All right, so we're gonna move on to the next one.
Another number out of Mr. Jack-o'-lantern. Oh, don't do that.
No.
Oh, okay.
Jack.
No, at one point in time, you had the papers and you shook them on the microphone.
Whoopsies. I apologize. Number 6.
I'm scared I'm going to exit out here.
Oh, there we go.
Number 6 is a reader.
Okay.
Number 6.
That's yours. All right.
Okay. Nurses who invented nursing stuff.
That's pretty cool.
Interesting topic. Nurses have developed many important cool inventions by identifying unmet needs in patient care. Their innovations often born from frontline experience ranging from life-saving medical devices to practical products that improve daily life for patients and caregivers.
Nice.
So,
The Crash Cart by Anita Dorr. Yeah.
By Anita Dorr.
What is the crash cart?
A crash cart is in acute hospitals, ERs. It has all the meds, epinephrine, atropine, all the meds that you would administer or supplies that you need when a resident has coded, like stop breathing, their heart has stopped beating. So rapid response teams have them. They're usually on every floor of a hospital, like I said, in the ER. So they're IV push meds and IV stuff. Yeah. They're mini med carts, kind of, but they're just stocked with everything that you need for a code.
So Anita Dorr developed this in a nurse's basement. It's now a standard piece of hospital equipment. That's really cool.
Mm-hmm. And then the next one is Ostomy Appliances by Elise Sorensen. She created the first plastic pouch that would be adhered to the body to manage ostomy leakage, improving life for her sister. So that's a colostomy or an ileostomy or a urostomy. So it's essentially the intestines surgically placed to the outer abdominal area, and that's how you have a bowel movement. So if you had like a small bowel obstruction, surgery for any reason, your GI system's not working, you can have them temporary. They can be long-term. We have quite a few residents that live with them. I couldn't imagine what life was like without that ostomy pouch, though, because it just leaks out. There's no control over the bowel movement. It's not like you can hold it in and then go when you want to go. So that's pretty cool.
Neonatal phototherapy by Sister Jean Ward. By observing sunlight's effect on jaundice in newborns, Ward helped develop a now standard light therapy for treating neonatal jaundice.
Yeah, it's for the little babies in the NICU. And it's like this big, kind of looks like those VR glasses, but they're blue and they just go over like the eyes or the face of the newborn. And it's just like this tiny little babies, this blue little glow all over them for jaundice. It's really cute. Well, I mean, little babies. Yeah, you know what I mean.
Next is the feeding tube. Bessie Griffin Griffin, a nurse and inventor, created an electronic feeding device to help disabled veterans feed themselves.
Yeah, so those are...
It pretty much is what it says it is.
Yeah, you tie so you connect it to the feeding tube, you tie the tubing through the machine, you set the machine, and it gives so many milliliters per hour. And you usually run them at night. So the tubing's not in the way, and then you can get up and go about your activities. But if you don't have that, you have to bolus the feeding, and it can take a while with a syringe, and you have to pour so much in at a time. So that's pretty cool.
Okay.
Color Safe IV Lines by Terry Barton Salinas and Gail Barton Hay. Color-coded IV lines were patented to help prevent medical errors, especially when used in neonates. Nice. I don't know, have you ever seen those pictures of like ICU nurses and all the pumps and all? That's just, the skill to have that is crazy amazing. I couldn't imagine. I like some of the TikToks so nurses like, I can't change my oil, but I know how to do this. And it's like 20 IV pump infusions. And I'm like, hey.
Very interesting.
And then the Wong-Baker Faces Pain Rating Scale. So if you go into like your doctor's office, you know, the faces, the sad faces, that's what that is. So that's really nice. We use that. I think it's just kind of like a standard now, especially for kids.
You mean
and stuff.
that didn't come from our smartphones with our emojis? It was around before then?
The emojis were probably created based off that. They probably saw that and they're like, let's create an emoji.
So it's so funny because you see those faces now. I automatically think those are emoji faces.
Yeah, and
we're all very relatable to them now. And we use them for all kinds of things, not just annoyance.
I know, right? I've seen the other, like an updated version of that scale, and they do actually look like emojis now. Like they're not just like flat. Like they have more.
Do they have the little barfing face on the?
They should, though. We should, though. Like, you know, for nausea, like, are you nauseous? Point, you know, we should. We should extend it and add to it.
Or the one where they're, like, green and you're about to.
Oh, gosh, yeah.
What face would it be for explosive diarrhea?
Oh, boy.
That face.
Yeah, that face. Oh, boy. Oh, boy. I don't know. Somebody running away. Like, you know.
Holding up the pants.
Yeah.
So 2 nurses created the scale of facial expressions to help assess children's pain levels in a way that could be easily easily understand. Well, then they adapted it for everyone.
Yeah, we like dementia or communication deficits. It's just easier to hold up that scale.
So is there a face with the fist, like pointing, you know, hitting the caregiver in the face, like, hey, that hurt.
Right? Like, enough. Oh, gosh. All right, disposable bottle liner by Ada Mae Allen. She invented a liner for baby bottles to prevent the nipple from unburdening when a baby drank, making feeding easier.
Oh, yes. I remember those bottles.
I do, too.
Are they even in use anymore?
No, with my last one, well, Baker's 7 now, so 2018.
We're really dating ourselves. I remember those plastic, and they were plastic that went inside of like a plastic tube, held it,
and it was open at the bottom.
Yeah, and then you screwed the top on.
I liked those. But then if you forgot one, it had milk in it somewhere. Oh, you're like, where's that smell coming from? Oh, it's that. No, I don't remember seeing those with my last one being born. I'm sure they've got to be out there. Like, so many new things. I had 7 years in between my kids, and then the last one came along, and everything was new again. All the equipment, everything that you do. Like, you know, they don't give your baby a bath anymore after they're born.
No?
No. They, you know, like you had a baby and they got a bath, right? Because they're all bloody and they have all that stuff all over them. So I had a C-section with my last one. I'm on day 4, and I'm like, they haven't given him a bath yet. So I call in the nurse, and she's like, no, we don't. You want to wait as long as possible before you give him a bath. I'm like, why? I'm like, that is disgusting. You know, he's still like, you know, there's blood, you know, behind his ear. And she's like, the bacteria or from being in you, the longer it stays on their skin, helps with their immune system. Yeah. And I'm just like baffled. I'm like, oh, okay, this is my 3rd child, and I had no clue. Evidence-based practice right there is pretty cool.
Well, the nurses were down in the nursery combing my son's hair. I'm like, where is he? After his bath. They're all down there giving him a hairstyle after his bath. So yeah, that's new to me too.
Yeah, no bath. And I looked at my husband, I'm like, you still got blood all over him. I'm like, when are they going to give him a bath? It was day 4. I remember with the other 2, it was a couple hours after birth. They were making sure they're okay.
Kind of makes sense,
Yeah. When I thought about it, I was like, oh, okay. I still gave him a bath that night, though. It was no, he's got blood everywhere. 4 days is good.
We're going back to the pumpkin.
All right.
Dun,
What do we got?
dun, dun, dun. What do we got?
Number 9.
Number 9.
Good one.
Good one.
They did such hard work on this.
I know. I'm really
And
impressed.
it is good.
It is very
They did
good.
a very good job. Here we go. ER stories that are almost too crazy to be true from the readersdigest.com. I'm kind of scared.
Yep. Seen a lot of TikTok videos on ER stories.
Oh, and of course, the Reader's Digest. Sit much as might be expected, many nurse stories involve the uncomfortable placement of objects in orifices where they most certainly don't belong. This one is no different. Rebecca Lee, a registered nurse from New York, who also runs a natural health remedies resource, tells the story of when a gentleman came to the emergency room explaining that an extreme rectal pain and a foreign body was lodged in his anus. It turned out to be the leg of a wooden stool. How it got there? He fell onto it when it was upside down, and it got stuck inside of him. He asked us not to tell his wife.
Yeah.
Lee later says, matter-of-factly, these are the secrets of the emergency room staff won't tell you.
Oh my gosh. I took care of a resident. This reminds me. He had, those glass snow figure, snowmen figurines. Somehow got it all the way up without breaking it. And they had to surgically open him up from here to here to surgically remove it. And on the x-ray in his chart, you could clearly see the snowman figurine.
What?
Yes.
Where?
A long time ago.
No, where?
What do you mean, where?
Did he swallow it or?
No, he pushed it up his anus, up his rectum.
That's incredible.
And they took an x-ray, and in the chart, I remember opening the chart and being like, what is that? And then
It was like Frosty with the pipe.
yeah.
Did they shake him?
No,
Did they shake him?
Was it a snow globe or just
like a decorative figurine, but it was all glass. And he somehow pushed it all the way up. And then I don't know the circumstances of how he went to the ER or anything, but in order for them somehow to get it out, he had an open abdominal wound. So from here to here, he was cut open to go in and retrieve that. And in his chart, I remember opening it and you could clearly see the snowman figurine. Yeah, it was,
Crazy.
Oh boy.
A worm's eye view. Some experiences you can only hope to mentally block. One memorable day, a young lady arrived at the department weeping bitterly because she had something in her bottom. Dr. Marsden recalls. Dr. Marsden had by now expected it to be something that the young lady had stuck in there herself, or something that perhaps the lover had helped her place there. No, I asked her to lower her trousers, and Dr. Marsden said, and then bent down to peer at the object. And that's when I realized the object was peering back at me. The object was a worm.
Oh,
A large parasitic worm. It is the one time Dr. Madsen can recall having to vomit after seeing a patient. Doctor says these are the annoying things they wish patients wouldn't do.
Oh, so that she stuck it in there herself? by now and expected to be something that the young lady had stuck in there herself, or something that perhaps a lover. A parasitic worm. Don't people swallow those worms to help them lose weight?
Yes. Yes.
I wonder if that's what she tried to do.
That's what's going on.
So you can buy parasitic worms, like a tapeworm, swallow it, and that'll help you lose weight.
Well, this one was looking at the doctor.
Oh my gosh. Oh, it's so gross. Oh my gosh. Oh.
That is.
Yeah. You're
Can
supposed to.
you still buy a parasitic worm?
Well, people still get worms.
Yes,
So,
you can.
and how I've read how you can catch them is at night you put tape over your rectum and they get stuck to the tape, and in the morning you pull the tape off and they're the worms.
You can buy them online from other countries.
Yeah.
Yes,
Yeah.
And have them
And this
shipped
is
here.
still a
It's
practice?
still a practice. It's very common in China.
And how to get them out? You just put tape and pull them out in the morning. They come out at night.
Usually there's doctors you go in for a procedure
Oh, to get them
to
out?
have them removed.
Because they get so big?
Yes.
Wow.
Because they'll grow and grow and grow.
I want to be skinny, but I don't think I'd go to those lengths.
Yeah. Thank goodness now there's
Oh, is that-
Ozempic. Yeah. Wegovy. I'll
Oh
let
my
you read
gosh.
number 3.
Another DIY wife. In 1974, when I was an orderly while attending nursing school, we had a gentleman brought in who had been injured in a car wreck, recounts Benjamin Evans, DD, DMP, RM, president of the New Jersey State Nurses Association. He needed facial surgery and a jaw wiring. Evans noticed that the man's wife seemed anxious. He could also tell that they were not financially well off. Finally, just before the wiring was to take place, the wife spoke up, asking Evans if she could remove her husband's dentures. It turned out that they shared the dentures, which they had purchased secondhand from a local funeral director. Oh my God. Okay.
Well,
Dentures are
that's
fitted
thrifty.
per person. So if they fit his mouth and then she's wearing them, they're probably not fitting very well, or they're using a lot of adhesive to keep those suckers in. I'm like, oh my God. A funeral director.
what's that show? The Cheapskates show or whatever it is?
Oh, that, yeah.
What do they call it? I can't think of what it's called. It's a reality show. But this
Yeah.
reminds me of an episode that I seen on that show where the lady was so cheap and she had to have a tooth pulled that she had her husband watch videos.
That's right. You told me about that.
And he then, it was going to cost $168 at the dentist office, and she didn't want to pay it. So she had all of the medical supplies, went to a garage sale and got like an antique tooth puller thingamajig.
Oh.
And in her recliner chair at home, her husband pulled
the
her
tooth.
tooth out.
Oh my gosh. They're professionals for a reason. Yeah. Oh, wow. Dentures from a funeral director. Oh.
That means they came from somebody who passed.
Yeah, and then who decides who gets
I
to wear
guess
the
they
dentures
can't-
that
they
day?
can't take the teeth with them.
No. But who decides who gets to wear the dentures on what day? Like, oh, it's your day to wear the dentures?
How does mealtime go? Like,
Oh, you eat
you
first?
eat first and then I'll eat. You put them in and be like, oh, I guess that meatloaf was pretty good.
Oh my gosh. Oh boy.
We've heard of some crazy things. Like,
Yeah.
that's a new one.
Yeah, that's a new one. Oh my goodness.
How'd that get there? One elderly patient came in alone, fairly disorientated, recalls Lee. He was incontinent and couldn't move well on his own. The hospital couldn't locate any family, and he seemed to have no visitors. But then one day, the man insisted that his daughter had stopped by. Lee humored him, patiently listening to him tell his daughter's visit, which included giving him a $5 bill. He was so insistent that he actually searched everywhere for the $5 bill, but he couldn't find it. Then later that day, when Lee was changing the patient's diapers, a well-crumbled $5 bill popped out from inside his belly button. Afterwards, he looked at all the security cameras, but never saw his daughter stop by, or anyone else for that matter.
How do you
Where did the $5 bill come from?
Where
that
was the $5 bill?
scrunched up in his belly button?
Where did it come from? I had a nurse once tell me they were prepping a patient for surgery, and I don't remember the details of the surgery or anything, but they were prepping her. They found a half-eaten hot dog under one of her abdominal folds. Before surgery.
Are you in your recliner and you lose your hot dog and it's just gone forever?
Yeah, it's gone. They thought like it was half-eaten hot dog in tucked in.
How long was it there?
I don't know. But yeah.
Well, you know, there was that viral video of, where was that at? California, where... And this was really unprofessional, but they've all lost their jobs because they were filming after someone had been on an exam table.
Oh, yeah, in an urgent care, I saw that.
That's kind of gross.
That's mean.
Yeah.
People are coming there at their most vulnerable.
Be professional.
They're sick. They don't feel good. They need help.
At the levels that people are out there trying to go viral.
Yeah. No, that's not cool.
It's not. It's really not. But okay, so on to the next.
Oh,
magic pumpkin. Ooh, here we are.
Okay.
What do we got?
4.
On this one, you can do like the top 3, top 4.
Okay.
Nurses that have died in service of others. Okay, nurses that died saving lives. According to Google, historical records and recent events document numerous nurses who have died saving lives, particularly during wartime, natural disasters, COVID-19 pandemic, and their heroism reflects the dangers inherent to the compassionate duty.
Mm-hmm.
Military nurses often worked under hostile conditions, exposing themselves to the same dangers as combat troops to provide critical medical care. Captain Jennifer Marino, in 2013, Marino was killed in Afghanistan when an improvised explosive device detonated. She was part of a special operations mission and died while trying to help wounded soldiers.
One of my nursing instructors was a nurse in, I think it was the Navy or the Marines, I can't remember, but on the first day of class, he showed us a picture of what their like makeshift hospital was over in Afghanistan and Iraq after a trauma that had happened. Yeah, that takes a special kind of person and a nurse to do that. Yeah.
Aren't they like just tents over there?
Yeah, basically. And just blood everywhere, and it's
not really a sterile environment because you're out in the desert.
Yeah, as best as it can be. Yeah.
Well, Jennifer, thank you for your service and condolences to her family for the loss. First Lieutenant Sharon Lane, during the Vietnam War, Lane was the only American servicewoman killed by direct enemy fire. In 1969, she died during a rocket attack while tending to patients at the 312th Evacuation Hospital in Chu Lai.
Wow. I want to do the nurses during the COVID-19 pandemic. Healthcare workers worldwide, including nurses, were disproportionately affected by the virus as they cared for the sick. Filipino nurses in the U.S., Filipino nurses who make up a significant portion of the nursing workforce in the U.S. experienced a disproportionately high death rate from COVID-19. While comprising 4.5% of nurses, they accounted for 25% of the deaths during the pandemic.
Wow.
Yeah. That is something. Yeah. I mean, we look back, we don't really like to think about COVID-19 too much because it was very, but yeah, yeah.
Do one more.
Some nurses have sacrificed their lives while caring for others during catastrophic natural disasters. Boone McCreary, in 2024, a Tennessee nurse, Boone McCreary, died while attempting to rescue a man from floodwaters. His last social media post spoke of having a life wish. and experiencing life to the fullest by helping others. A scholarship fund was established in his name for helping other adults returning to nursing school.
Yeah, doesn't stop when you leave your job. Yeah.
We had one of our own nurses that worked for us.
Amy, yep. She
was someplace. What
in
was
Milwaukee.
the story behind that?
She was in Milwaukee for something. I can't remember exactly what, but a gentleman had a heart attack, a myocardial infarction, and she was a part of, I think, 2 other Good Samaritans that saved his life. And he had a widowmaker, which is essentially like one of the most severe MIs that you can have, and the survival rate is very low, but he ended up surviving it, and they performed CPR on site until the paramedics got there and took him to the hospital.
So she didn't lose her life, but she jumped in to the call of duty.
Oh, yes. And she performed CPR, yes.
Yeah, when someone needed the help. And that's what people do. That's what nurses do. All right. We're moving on to the next
Our little bucket. 8.
Yeah, boy.
There's a chuckle. Are you
know,
nervous?
right?
I might be a little nervous. Number 8. Here we go. 5 nursing stories to make you go, from shiftmed.com.
On these, are these the long ones?
No,
Okay.
not yet. So this is someone's blowing smoke. I had a patient tell me smoke was her method of birth control because she'd heard that fertility. Oh, sorry. Let me start over. I had a patient tell me smoking was her method of birth control because she heard that infertility was a side effect of smoking. There's some crazy myths out there.
Yeah, and then TikTok. A lot of people have been cite their medical information or education from TikTok.
Yeah, wasn't there a trend on TikTok that people were eating borax?
Yeah, or was it? I can't remember, something during COVID too, that they were getting off. They were doing from TikTok to treat or prevent COVID or something, and it had like no medical based scientific evidence whatsoever. Oh goodness. Ugh. Liar, liar, pants on fire. We all gathered around the bed of a patient having a grand mal seizure, watching her arms and legs shaking uncontrollably, except there were whispers that maybe she was faking it. I reached over and gently tugged the pillow out from under her head. She quickly reached out with her hand, grabbed it, tucked it back under her head, and kept seizing.
Busted.
Yeah. If you're having a seizure, you have absolutely no control over any of your limbs.
Come again. A patient once wrote that they had a fatal heart attack on their intake form.
Fatal?
Fatal heart attack.
They were there as a ghost. Yeah.
Cool.
Someone needs a mint. My first patient with a colostomy was this old grumpy man. When I started taking off his bag, it smelled so bad my eyes were watering. I kept telling myself to think about his feelings and not to let anything show on my face. He looked at me and said, "God, you've got bad breath." Oh, boy.
Catastrophe averted. We had a patient complaining that a cat allergy medicine we gave her wasn't working, formulated in an inhaler. As it turned out, she was spraying the inhaler at her cat. We had to tell her that she needed to inhale it. That's great.
Yes, discharge instructions are really important. Yes, to read and pay attention to.
All right.
All right.
Here we go.
10.
Books.
10.
Just a couple.
3 crazy nurses' stories according to Reddit. You want to
This happened when I was in my first year of nursing school. I got a job as a nursing assistant at a local nursing home. The director of nurses was very nice. She dressed a little odd for an upper manager. A couple of weeks and everything is fine. Then I get notified the next day I'm supposed to report to have my skill level assessed along with a few other new hires. We go into an empty room, and there is our DON in a leotard, and here's where it gets crazy. She plays a part of a resident. She has us simulate doing peri-care on her. She tells me to transfer her from bed to a wheelchair. She licks me across the face, and in shock, I drop her. She tells me I need to be ready for anything. Yeah, but not for my boss. The next guy, she grabs his crotch. We're all really uncomfortable, and I guess she sensed it, and we were dismissed. A week later, I come in for my shift, and there is a lot of commotion in the front office. Police are there. Apparently, the DON was working on a dead nurse's license and has spent the last 10 years going from place to place, job to job, using dead nurse's license. She had half a dozen aliases. I'm also very interested when I see a new DON to see if she ever pops up again. Maybe there's a reward. Oh my gosh. I'm taught skills. I'm never having anybody do peri-care on me, okay? No. Oh my. I think I'd be reported to HR if I did that.
There was just a nurse in Florida that was arrested for operating on a false license too, and she got away with it for
I don't know how you do that.
a fairly long period of time before they caught up to her.
I don't know how you do that. You have to pass a board. You have to pass a background. To me, it's just crazy how, I don't know. You think there's so many checks and balances in place for that, but that's pretty crazy.
There's all kinds of scams out there, and it's crazy what people will do. A young adult was dying from a genetic disorder. She had been on hospice, but when she entered the hospital, she made her mom her POA. Mom made her a full code. After being coded several times over the course of the week, the poor girl was already decomposing. Her limbs were, what's that word, Stacy?
Necrotic. Dead, died.
And she had an open belly and a necrotic bowel. My consolation was the patient was beyond feeling pain at this point. She survived several codes, but inevitably we couldn't get her back again. The mom insisted on taking the body home because her daughter was going to rise on the third day. Turns out it was perfectly legal. At least it was in that jurisdiction to take the body home, provided the correct paperwork was done. The family loaded the corpse into the back seat of the car, and they were unzipping the body bag before they drove off. It was a hot summer. Counter to their path, the corpse did not rise on the third day, from what I heard, and the sheriff had to take action to get the body removed from their house.
How is that legal, to take home a dead body?
I've never heard of such a thing.
No. And then just to sit it in the back seat?
It is your property.
What?
But you can bury someone on your own property, can't you? I think, is that legal?
Yeah, but you would still have cemetery.
Yeah.
You'd have to prove it. You'd have to show that the body is buried and taken care of. So
Yeah.
you don't just get to bury bodies. It has to be reported and documented. Yeah.
Oh, that's awful.
That has to be one of the strangest things I think I've heard.
Oh, boy. Yeah.
But people do crazy, crazy stuff.
I know.
We're a witness to that. I mean, we shouldn't be this shocked, but I'm kind of like...
every time you watch the news, you're like, what? Yeah. You want to skip this one and go on to pull another one?
Pull another one.
Okay.
Go ahead.
All right. Number 1. I think it's a video. All right.
Here we go. We're back to a video. Video, Nurse Meg.
This is part 23 of creepiest things that have happened to me as a nurse. This time I was working in a nursing home. We had a brand new resident move in. That's what they call them. They don't call them patients. a brand new resident that moved in, and he was technically on hospice. So they were like, I don't know how long he's going to be here, but unpack his stuff, get his MAR medical record and everything, get a chart set up. And so, yeah. And I worked the 11 to 7 shift that particular day. Of course, I'm always on night shift. Like, I'm such a vampire. So on this fateful night, it was probably around 3 a.m.-ish, like right in the middle of the shift. And we hear like him yell from his room, which was of course at the end of the hall, I'm not going, I'm not going, I'm not going, like 2 or 3 times, I think. And me and the CNAs that were there, it was me and Dawn and Melissa. We all looked at each other like, I'm not going, you. Finally, we decided, let's all go, so that we can all support each other. And when we got to the room, we could not find a pulse. He was a DNR. He had passed. Who was he talking to saying, I'm not going? And where was he going? And I have goosebumps now.
Where was he going? Oh my gosh. Yeah, working at night's a little creepy. Yeah. Yeah, the hallways are, yeah, it's
Do you
creepy.
hear things, or you think you hear things, or do you feel any, one of our stories has to do with like cold spots and chills and...
I've never really experienced any of that, but it's just, I don't know, there's just a creepiness to it. It's like, I was always normally a day shift nurse, but sometimes you'd pick up extra shifts or what have you. And it's just eerily quiet when the unit is always so busy and, people are up and moving around. You got PT, OT, or, and then at night it's just so quiet. It's creepy, especially towards the end of the hallways, like she's talking about. Definitely go with strength in numbers. I'm not going down there by myself. Yeah.
All right, well, let's move on to another one.
Right. Oh, we've got number 3.
Last video.
Oh, last video? Okay.
Video from Haunted Grove, Scary Socks.
How did you get back there? Oh, there we go.
This is probably one of the creepiest things that has ever happened to me. When I was younger, I was working night shift in a nursing home as a CNA. The night shift in and of itself is pretty creepy, but I had been doing this for years, and so it didn't creep me out that much. But one night shift, it was like 4 o'clock in the morning, and I was getting a resident ready for the day shift CNA when they came in. We were always short-staffed, so it was just something we did to help out, just what we could, especially for the residents that like to wake up early. So this particular resident had a roommate, and for our rooms with 2 people, there was usually one person by the door and then one person by the window. So my guy was the window guy. So I'm walking in the room and it's dark. Again, it's like 4 o'clock in the morning. I'm not about to turn the light on these poor people. So I just flipped the bathroom light on to give me a little bit of light so I could see what I was doing as I walked past door guy over to window guy. And as I'm walking over to my guy, I feel on my shoulder like this huge hand just kind of grab my shoulder. Not in a hard or threatening kind of way, not in a mean way, but just like somebody trying to get my attention kind of way. So I immediately assumed it was the roommate, but when I turned around, there was nobody there, and the roommate was sound asleep in his bed. So again, it's late, it's 4 o'clock in the morning. I convinced myself that I'm just imagining it. It's not a big deal, just get your shit done. So I go over to window guy and I'm getting him ready, and we're having a conversation, a quiet one because the roommate is still sleeping. So I get to the part where I have to put his TED socks on. And if you don't know what TED socks are they're very common in healthcare. They're really tight socks that you put on and it helps with circulation. But when you're working in a nursing home with the elderly, because they have such thin skin, you have to be really careful that there's no wrinkles in them. Otherwise it can damage their skin. So I had come up with this method at this point to kind of ensure that there was no wrinkles in the TED socks, where I would just kind of go like this with my fingers, go over the tip of their toes, and then, run my hands down to make sure that there was no wrinkles in the TED sock. So as I'm doing this, I'm getting him ready. I get his TED socks on and I walk over and I do the right thing and I run my hand from his toes to his knee to make sure there was no wrinkles. And just when I get to his knee, I shit you not, I feel a set of hands go like this and do the exact same thing to my leg from my ankle to my knee. And I just about shit my pants because I was certain what I felt. Like somebody mimicking what I was doing to this person, but doing it to me. It was so creepy. And the creepiest part, like that wasn't enough. The creepiest part was the resident was looking at me like, what is going on? And I'm like, I didn't even know what to, like, what do you say? You know, like, I'm like, and whatever. And then he makes some comment like, oh, you look like you just seen a ghost. And that was not the last time something like that happened to me in this nursing home. So I am positive that this place was haunted. But I don't know. What do you guys think? Has anything like this ever happened to you? Leave a comment and let me know.
Wow, that's creepy. Yeah, like I said, nothing's...
It's funny you just say it. Night shift, it's creepy.
Yeah.
And then she's like, I was on night shift. It's creepy.
It is creepy. It is really creepy. Yeah, and then you're sleep deprived too. So who knows if you're seeing something that's, not there. But yeah, I mean, well, you think of a nursing home, how many people pass away there,
Sure.
Yeah.
We have to draw the last number.
I wonder. 5. All right.
Okay. This is our last story. Heartwarming and funny from thegypsynurse.com.
Just the top one? Oh, okay.
Go ahead, Stacy.
When the patient teaches anatomy to the nurse, I was caring for an elderly gentleman during a shift and was completely enjoying my time with him. Older men are often my favorite patients because they can be so sweet, but so funny. This man was incredibly witty and had a new joke for me every time I entered his room. My absolute favorite, which still makes me laugh to this day, was, how do you know what mothballs smell like? I can never get their legs apart. That one got me, and I wheeled him out to the nurse's desk so he could repeat it for everyone. Oh my goodness. Yes, older gentlemen, they have a lot of good dad jokes and good jokes. I've heard, I probably can't remember them, but they were really funny at the time. A lot of good dad jokes.
All right, so I will read the next one. The time the nurse explained it isn't lemonade. I had a very confused patient, and I was taking care of one night. He had Alzheimer's disease and was incredibly pleasant, so I enjoyed spending time with him and his wife. At one point, I saw his wife leave the unit, so I walked down to his room to keep an eye on him and make sure all safety precautions were in place. I stopped dead in my tracks in the doorway when I saw him drinking from his urinal like it was a bottle of juice.
Oh.
I rushed over and pulled the urinal from his lips and sweetly asked, "What you doing, bud?" And his reply was, "I wanted to drink this lemonade, but it tastes terrible." My response was, "I bet it does," and I proceeded to empty it and leave it in the bathroom where he could not reach it on his own. And I informed his wife of the interaction, and she returned, and we both got a good laugh out of it outside of the room.
Oh, that's awful. On a side note, though, that's like way back in the day, like hundreds and hundreds of years ago. That's how they diagnosed diabetes, is the physician would taste the urine of the patient. And if it was like sweet, they knew that they had diabetes. Isn't that crazy?
What? Really?
Yeah.
That's a true story?
Yeah, it's, I mean,
What
this is
century
like,
was that?
oh gosh,
Like the 15th century or?
1700s or something like that, yeah. But yeah, they would taste the urine and it would, yeah, that's how they could tell if they had diabetes
so
or not, if the urine was sweet.
The resident.
Does that work?
Yeah, back in the day, I guess it did. I don't know. I'm not going to test it out on myself.
sugar in the urine.
Yeah. One more.
Yeah.
The sassy patients nurses love. I was working in a detox facility when 2 girls broke out into a fight one night. I stepped in to stop the fight and asked what it was all about. One girl started screaming that another girl had borrowed her jeans and she had crabs. She came towards me with a pair of tweezers and said, "See, look at it." I had these tweezers coming at my face, so I quickly grabbed her wrist and focused on what she was holding. As my eyes were adjusting, I realized she had an actual crab in her tweezers. I yelled, "Crap, don't let that thing go." I'm laughing thinking about having just come face to face with someone's crab. I put it in a baggie and called the on-call doctor. I related everything that had transpired and then got treatment for everyone. Oh, yes. I think that's a nurse's worst nightmare is bed bugs and scabies. Like, I can deal with a lot of things, but the minute you mention bugs, I start itching. I'm like, oh. Oh.
Oh, man. Well, this was a lot of fun.
Yeah.
Actually.
Lots of crazy
talking
stuff.
about all these crazy stories. And Wow. I learned a couple things. Like I didn't know doctors tasted urine.
Yeah.
Way back when.
Way back when, yeah.
I mean, this is before there were labs.
Yes.
The doctor was the lab.
Yes. What you would see, smell, taste, hear, that's how you diagnosed.
Very interesting. Well.
Which one was your favorite story?
Favorite story.
I like the nursing home at night ones. Those bring back good memories. I mean, like I said, it is creepy, but those are good times.
I'm always intrigued by the murder stories, and it is
the psyche of those
the
people.
why, the crazy, just
the rationale behind it.
There is no normal rationale.
No, but the psyche of it. Like that Netflix show Mindhunter, where they're like Ed Gein and the FBI is interviewing them to profile what they were identifying as serial killers. I think it would be interesting to figure out like the psyche of medical professionals and why they go down that route. Like, is it a different, thought pattern behind it?
Exactly.
Because I mean, they're serial killers.
Right.
I mean,
they are what they
22 patients for
under
the one.
guise of being a nurse.
Mm-hmm.
It's insane.
Yeah.
For sure. Well, it's been a fun episode.
Mm-hmm. Yeah.
Let's do this again. We got, again, kudos to Nurse Stacy for being here.
It's always fun being here.
We enjoyed talking about nursing nightmares, and download our next episodes that are going to be coming, and we got a whole new year coming in 2026. So thank you for watching.
You can find the We're Talking About It podcast on YouTube, YouTube Music, Spotify, Amazon Music, and don't forget to like, follow, and subscribe.